Hi, my name is Tanner Grover. I'm 36 years old and I live with SMA type 2. Today, I just took my first dose of the new Evrysdi oral liquid that was FDA approved on August 7th. I'm making this video and potentially a series of videos over the next year to document my progress with the Evrysdi drug. And I'm hopeful that anyone who has SMA might be able to learn something from my experience and maybe help them along their way. So, in this first video, I'm going to be covering a timeline of my process of obtaining the drug and taking it for the first time. All right, let's get into it. So, Evrysdi was approved by the FDA on August 7th. On August 25th, I had a telehealth appointment with my neurologist, and they already knew what I was calling about. And so they said from here they were going to reach out to Genentech, the company that makes Evrysdi, and see about getting me a prescription. So on August 29th, we received a form in the mail. It's the Evrysdi Start form. Now, Genentech sends this form out. It's a two-part thing. Part of it, my neurologist has to fill out, and part of it, I fill out. So we faxed that over on August 29th, no, August 31st, sorry about that, and then called to confirm. We called Genentech on September 1st to confirm that they got our portion of the form, and they did, and they had it in its entirety. And so the next thing that we got in the mail was a denial letter from insurance, of course, the first of many to come. That was on September 8th. And my insurance is Anthem Blue Cross Blue Shield. And they stated in the letter that they did not receive or could not see any records of my SMA diagnosis. So I was diagnosed at 9 months of age. Anyways, with this denial, my neurologist began the expedited appeal process. That same day, we also got a phone call from a Credo RX pharmacy. So that's the pharmacy that Genentech works with to distribute Evrysdi. And we gave Credo my personal information because they're going to be the ones to eventually compound and ship out the drug. So even though we got the denial letter, we're like, all right, things are still moving. Then on September 9th, we received a phone call from my caseworker at Genentech. And they just told me to sit tight and that they're working with a neurologist on this expedited appeal process. On September 14th, we received a letter from Anthem stating that they received an expedited appeal form from my neurologist. And then promptly on September 16th, we received our second denial letter from Anthem. They stated that this time around, their reviewer, Kevin Paramesh, an MD who specializes in neurology, recommends Anthem keeps their previous coverage decision. They would consider approval had the onset of my SMA been diagnosed prior to 3 months of age. But being that I was diagnosed at 9 months, they can't deem Evrysdi as medically necessary. So this is kind of funny because at the time I was born, there was no test for SMA. I was born December 28th, 1983. So there's no way to even know that I had this at 3 months of age. Plus, I wasn't showing any signs or symptoms that were noticeable to anyone at that particular time. So, my neurologist on September 17th, the next day, then submits an appeal letter to Anthem explaining what I just told you. Um, and he goes on to explain that those who study SMA know that the disease is actually present prior to birth, um, and that symptoms manifest at various times for various patients, For me, it was 9 months, and that's when I got diagnosed. He also addressed, in the initial denial, the claim that they had no records of my SMA diagnosis. And so he included a copy of a genetic test I took in 2017 through Baylor University when I was looking at getting a Spinraza treatment, which I ultimately did not do. So I had done genetic testing not that long ago. And in that test, it did indeed confirm that I had SMA. So flash forward to September 29th, and we receive a letter from Anthem stating that they received the September 17th appeal from my neurologist. And then the next day, on the 30th, we received our third denial letter from Anthem. In this letter, they stated this time both Anali Kaku, an MD who specializes in neurology, and Bernard M. Betancourt Jr., a DO who specializes in emergency medicine, have reviewed this now second level appeal and denied the request based upon this specialty match review process. Um, the reviewers state that Anthem's policy requires that the disease started before 3 months of age, and that the notes provided by my neurologist do not show that I meet the criteria. Wow. All right. So we thought third time might be a charm, but it wasn't. So where do we go from here? On October 5th, we contacted our caseworker at Genentech and inquired about the next steps. And the caseworker explained that they were going to reach out to the neurologist and be in touch from there. And I just want to state that this caseworker, it's someone that is totally like batting for you. And I have this person's phone number. We text more than I'm highlighting, in this video. So Genentech is really, working their butt off to make sure that their patients do receive the treatment. And I just think that's really reassuring and awesome on their part. And they're not paying me to make this video or anything like that. I'm not sponsored by anyone. So just, in the uh, essence of clarity, I hope everyone understands that. From here, a little bit of time goes by, and on October 14th, the neurologist's office reaches out to say that they'll be sending out a genetic test kit to get my blood drawn and update my SMN count. So I'm thinking that's encouraging because we want to get those numbers. Because if you actually take Evrysdi, it's a drug that increases your SMN count. So, we probably want to get some kind of base level for where I am right now. So maybe things are moving. Then on the 16th of October, this is kind of a big phone call. We get a phone call from Genentech explaining that I've been accepted into the Genentech Patient Foundation, which is a program that covers the cost of Evrysdi for patients whose insurance companies are unwilling to pay. That is awesome, awesome news. They explained that Accredo, the pharmacy, they're going to be in touch with me about receiving my first shipment. They also explained that they're going to continue to work with my neurologist on getting insurance to eventually cover some of the costs, but they didn't want that to stand in the way of being able to take Evrysdi. So that's what I mean when these companies, they are working for their patients really hard to make sure that you're able to get it, and that's awesome. Then on the 20th of October, which was last Tuesday, uh, I received the genetic test kit in the mail from the neurologist's office. The day after, we heard from Accredo, the pharmacy, and we talked about getting our first shipment of Evrysdi, um, and that they're going to be sending my prescription out in the mail the next day, and I should expect to have it via UPS very shortly. On October 22nd, last Thursday, I went to our local medical center and got the blood work done. Later that day, I spoke over the phone with my case manager and went over the procedure for how to take Evrysdi, and I will provide a link to those steps. It's on the Evrysdi website, but it's pretty simple, pretty straightforward, and I will link that in the bio of this video. And then on October 23rd, yesterday, we received our first shipment of Evrysdi, and it comes on ice in a great big box. You gotta store it in your fridge. Um, it is light sensitive, so I wouldn't take it out of the box. I mean, you take it out of the big box, but the smaller box that the vials of it are actually in, just put that entire box right in your fridge, because you don't want to let it expose to light, where it reduces its efficacy. Um, and then today I took it for the first time, and I'm sure people are going to want to know what it's like. As far as the flavor, it doesn't taste bad. Um, it's basically strawberry watermelon crystal light, which if you haven't tried, go out to your local grocery store. It's fantastic. Um, I will say that the mechanism of getting it from the plunger um, out of the bottle is a little bit wonky. It's going to take some practice to get that down and make sure we get it right every time. But I'm sure we'll get the hang of it the more we do it. All right, so that about does it. In the next video, you expect an update, maybe a month from now, and I'll be able to talk a little bit more about the effects of the drug and how I'm handling that or any improvements. I see initially. I was kind of told that it takes about 4 weeks to take effect. So we'll see. Either way, it's an exciting time. All right, thanks for watching, and if you have any questions, leave me a comment, and I will do my best to get back to you. All right, thanks. Bye.